Amarillo is one of only a handful of Texas cities that gets a COVID-19 report card every day. All of the data put on it, new cases, deaths, recoveries, and more, collected and compiled by the around 90 employees, a mix of part-time and permanent staff at the Amarillo Public Health Department. Last week, I was given behind-the-scenes access to a PhD to learn more about the process and the people behind it. From screening symptoms to testing results.
This is just the way to access their lab portal.
And contact tracing and monitoring, the Amarillo Public Health Department is the information center for the coronavirus pandemic.
It takes a number of team members, it takes a number of processes, so much data entry and tabulation and calculation. If it were as simple as like just counting the number of cases, it would be very simple, but it really is an iceberg under the water.
Since the virus reached the High Plains in March, many of their normal programs have been halted, and staff members have stepped into new roles.
Roll with the punches.
Terry Bradford usually runs STD testing, but now she's the main point of contact for COVID testing in nursing homes and other assisted living programs, tracking positive cases and conducting contact investigations.
This and STDs in some ways are very, very similar. You have to protect yourself, you have to protect others.
And so if somebody has come into contact with a person who tests positive, how will they find that out?
So after we get that electronic contact investigation back, the form that the patient fills out and sends back to us, then our team calls their contacts.
So they'll get a direct call or they'll get, some
Right.
sort of email, that kind of. One of the services that public health is providing is checking in on COVID patients who are elderly, live alone, or who have special needs, which can take an emotional toll.
And you get attached to them. They get attached to you. And you just want to monitor them because sometimes things can turn really from one day to the next.
That heart for helping grew other programs as well.
And so we realized early on that our patients had needs greater than just contact tracing. And so we developed a social services team.
That team providing groceries and other necessities when there's a need.
During this pandemic, a lot of us are facing hard times, and I'm glad that we've been able to help individuals through the hard times through the various programs we have here at Public Health.
These are we've not had any bad tubes or anything come through. These things have been wonderful.
Testing continues at the city's free drive-through testing site. Mark Price has been there since the beginning and has watched the process become more streamlined.
Getting through here, it takes about 4 minutes to get a test. And the results through PPL right now are taking, the longest that we've heard recently is 48 hours. They are really quick.
It's work some have been critical of. Stoughton says she fields calls and gets messages from people who are upset every day.
Our city staff and our public health staff and our environmental health staff, we're your neighbors. And we're truly doing all that we can to make this situation better.
What we can do to make the situation better, shared by all the employees who I interviewed.
Wear your masks.
People, please wear your mask.
Well, I just definitely suggest, still continue, wearing the masks and social distancing. They do work. We just have to practice them.
The Public Health Department will help distribute the COVID vaccine as well. Stoughton says they'll help to implement the state's allocation plan, and the department has registered as a provider too. The story continues at myhighplains.com. Hear from Stoughton about the city's decision when all of this started back in March and even before, not to release results of contact tracing publicly, and much more from her.